Hi, so today we're going to be talking about prescription drugs and misuse of prescription drugs and why it matters. Prescription drugs do save lives, but misuse of them is rising with over 14.3 million Americans ages 12 and up misusing prescription drugs at least once in their life since 2021. And many believe if it's prescribed, it's safe, but that's not always true. Over 20% of America has abused drugs at least once, making that 1 in 5 Americans. So commonly misused medication includes painkillers like oxycodone and hydrocodone. There's depressants, which is Xanax and Valium, which a lot of students use for anxiety and sleep. There's stimulants like Adderall and Ritalin, which is for ADHD, or sometimes students will tend to misuse this in order to study at higher rates for higher concentration. And misuse is basically taking medication without prescriptions, taking too much of a certain medication, or doing it for non-medical reasons. So why do people misuse? A lot of people misuse to manage pain, stress, or as we talked about, boost energy or concentration. There's an easy access to them with over 70% of people getting pills from friends or family, and misunderstandings. A lot of people don't understand the risk or the dependence potential that people face when beginning to use prescription drugs. So, consequences. Consequences, as we talked about, can be addiction, it can be overdose, or it could be death. 1.8% of US adults have an opioid use disorder. Health issues like slowed breathing, heart problems, memory loss, and physical symptoms do manifest. It can be physical dependency, it could be psychological dependency, it could be nausea, it could be faintness, it can be dizziness, it could be like the actual physical need for it as addiction. There's also legal and social impacts. A lot of the times, misuse is illegal and it shouldn't be done. Social impacts, like a lot of people facing addiction, facing the use of pills, tend to stray away from friends, family, loved ones, and they join a different kind of circle socially. So, prevention and safe use. Take the meds exactly as prescribed. Store it in a secure place where people can't access it easily. When you're done with the medications, you have extra. There is proper ways to dispose of it. Don't just leave it in your cabinets. Don't just leave it in the trash. You can take it to. You can ask your pharmacist, where can I dispose of it? You can ask your doctor. You can even ask questions at the pharmacy, like what are the risks of the medication before taking the medication. And then takeaways. Prescription does not mean risk-free. Misuse affects millions of people, but education saves lives. Use knowledge, be informed, like know what you're taking, know what the risks are. And don't just go by stigma, and stay safe with whatever it is you decide to take. Make sure you know what you're taking, the dose, and make sure it really is what you're expecting, not synthetic drugs like we talked about. What's one thing you'll do differently on vacations? Just think about the question, reflect on it. If it does apply to you, if it doesn't, think about it for others as well. And that is it. Thank you.